We have a hot topic today. We're going to talk a little bit about Medicare Advantage. Now, there's no doubt that home health, hospice, and palliative care organizations need to be prepared for Medicare Advantage. And really, Hannah, the numbers speak for themselves. According to industry research, Medicare Advantage enrollments is projected to grow from 54% of the eligible population to 60 by the end of the decade. All right, decade. That's a long time, right?
I know.
Additionally, it accounts for about 462 billion, or 54% of the total federal Medicare spending.
And today we have with us Erica Gregory, who is the Senior VP and General Manager of Revenue Cycle Management at Netsmart. Erica Gregory oversees all billing and back office operations for healthcare organizations across the country. Through strategy, measurement, and execution, she works with internal teams to ensure the client achieves optimal financial performance. She is an expert in operations and business development, displaying a track record of consistent, substantial, and measurable success across healthcare and technology. She is dedicated to exceeding goals by delivering results that directly impact the bottom line. She accomplishes this by leveraging Netsmart teams of skilled expertise in technology innovation. Prior to joining Netsmart, Erica was an executive at Cerner Corporation for over 10 years. Her roles spanned from financial management to business development and automation. Erica is a long-standing member of the Healthcare Financial Management Association and is a certified healthcare financial professional. She received her bachelor's degree in economics and accounting from the University of Kansas. Welcome, Erica.
Are you a Jayhawk fan?
I am. Rock Chalk.
Yes, I went to a Jayhawk game one time. I took my wife, and let me tell you,
a basketball game, right?
Yeah, it is it's a bucket list, first of all.
It is.
I love how the gym is kind of like old school gym, right? It reminds me of the show Hoosiers. Remember that?
Absolutely.
Well, anyway, great fans. I'm not a Kansas fan, but my wife is a Kansas fan. So I have to like Kansas, but it was an awesome time. So a little sidebar there, but I thought you should know that.
Yep, absolutely. You cannot beat a game in Allen Fieldhouse. It's a place to be.
Yeah, it's a great game.
Yes, wonderful. Well, thank you guys for having me today.
Yeah, absolutely. So let's dive right in. So Erica, given the impact, where do you suggest revenue cycle teams start with setting themselves up for success here in the Medicare Advantage world?
Yeah, it's a great question. And you're right. It's such a hot topic right now, and something that is really pivoting for organizations as they set themselves up for success in this new reimbursement world. And, I think not only the statistics that you shared, but also as we look at potential impacts of, different political situations and kind of the new administration coming in, we are forecasting that more and more of our CMS programs are going to go more of that managed population. And so it's really important for business leaders to be really skilled and thoughtful about how they're approaching this. And, not uncommon to any other revenue cycle reimbursement program, I'm a big believer in start at the beginning. There's so much of successful first pass pay rate that comes from really focusing on your pre-service activities. And that's everything from really understanding the reimbursement policies and contract related to the reimbursement, but also then really nailing those pre-service activities around eligibility and authorization. When you look at the claim form that goes out, over 60% of the data on that claim form comes from those steps in the process before you ever provide a service. And so if you get that right, you're just so much further ahead of the game on being successful on getting reimbursed timely.
You mentioned eligibility.
Yes.
And let's talk a little bit about eligibility and prior authorizations, ultimately in the support of value-based care.
Sure. Yeah, it is really important. And I think it's not something that is commonly talked about in value-based care. But when you think about enhancing access to care, right? So many of our organizations across home health and hospice and palliative are really feeling this labor crunch that has come in. And so being able to provide access to as many individuals as we can, and knowing that our baby boomers are coming up and going to create more demand for these services. Having proper eligibility done up front only enhances the access that we have to care by making sure that we are providing the right services that are eligible and able to be provided. So having really strong eligibility processes that are streamlined and are fit to the plan that the patient has is incredibly important. I also am a firm believer in good eligibility and authorization improves care coordination. So by having the right eligibility and authorization information timely, then your providers have access to the information they need to provide good quality care as people are transitioning through the system. So pretty frequently in this space, we're getting patients that have already been seen in another venue. And so by having that prior authorization information and being able to see the continuum of the care that has been delivered, it's really important for that piece. We can't say enough about cost efficiency. When we get into that value-based world, we really need to be optimizing our back office or care administration workflows so that we can spend every dollar possible on actually providing care and making sure that we have all of the right providers in the ecosystem to take care of those patients. And then at the end of the day, it just really is a better patient experience when we're efficient with this. No one likes a surprise and no one likes frustration in trying to access care. So having good eligibility means we have a good understanding of what is covered and what is not. Having timely and accurate prior authorizations means that we don't delay necessary treatments. And so, for me, they have kind of a core foundation to this overall patient experience and timely and quality care.
Yeah. And you're preaching to the choir, so to speak. We rally with you around these ideas. So talking about the intake function of revenue cycle, let's talk about accurate coding. So what impact does accurate coding have on Medicare Advantage?
I mean, it's so important, especially as we think about any of our MA plans. They directly impact the financial performance, the regulatory compliance, and then the quality of care provided to those beneficiaries. So, when we look at, especially under risk adjusted reimbursement, those Advantage plans take a risk adjusted model to determine the reimbursement rates. And so accurate coding ensures that all of the diagnoses are captured, reflecting the true complexity of the patient care needs. When we look at compliance with regulatory standards, the Medicare Advantage plans are subject to really rigorous oversight to prevent fraud, waste, and abuse. And so inaccurate or incomplete coding can lead to audits and penalties, and in some situations, legal consequences. When we also look at our quality measures and our star ratings, the accurate coding, it really affects those performance metrics, such as the HEDIS measures, the star ratings, and those ratings absolutely drive your incentives and bonuses. So it can be really important when we look at the overall impact, especially under the MA plans. And then regardless of MA plans, the accurate coding drives so much of the treatment that it is just really important that we as organizations are making sure that critical function is accurate, is efficient, and is done in a complete manner. It's an interesting topic because, as I'm sure you guys are seeing, there's a lot in the market around automation and AI, right? And so coming from the acute and physician practice of the world, coding was a place that there was a lot of automation and computer assist done in the past. And so now it is a space that in our venues, there's a lot of conversation happening about how can AI or automation help us, probably never in a fully automated sense, but in a human in the loop instance to make sure that we are complete coding. It can provide auditing functions. It can do different types of OCR searches across documentation. So really provide a coach, not a crutch, to our coders.
Yeah, we talk about denials. It's almost a cuss word in the RCM space. You know what I mean? It's a bad word. We don't want to say denials, but they tend to pop up, right? Especially in the Medicare Advantage environment. So when we're talking about revenue cycle teams, right? Or maybe we even relay this to agencies, how do they set themselves up to address denials quickly and, to facilitate timely reimbursement?
It's a great question, and I'm a little bit of a nut about this because I feel really strongly about the management and prevention of denials. And so across all of my CBO teams, there is a couple of never events that we like to talk about. From a clinician side, there's always the never events that they measure to, but on the rev cycle side, we have never event denials that need to be prevented. So I am a believer in measurement, measurement, measurement. So having good, strong tools in place that you can use to categorize denials quickly, be able to segment them out, and then be able to prioritize them for your collectors that are out working them. So we use a host of different tools that include automation, some OCR, some NLP to be able to pull in all of the different formats that denials come in. And we're able to segment them to say these are the never event denials that we need to go and put really strong processes, or a process has been missed up front. But then also being able to categorize them, prioritize them, and queue them for workers means that you can get through them in a timely fashion. Anytime we hit a denial, you're adding probably 30 days to your reimbursement cycle. And so that's if you're addressing them in the first 4 days of receipt. If you're not addressing them that quickly, you could be, especially in an MA world, be looking at timely appeal deadlines where you are truly losing the money as opposed to delaying it.
Yeah. So what advice would you give to revenue cycle leaders trying to encourage their teams to adapt technology, including automation, like we've talked about, so that they can be successful with Medicare Advantage?
Yeah, I think, the technology space is moving so quickly. I mean, we all watch the news, and if you follow any of the healthcare revenue cycle journals, it is the buzzword, right? And so I think it's commonly thrown out there as AI, right? But the AI world is vast, right? It is the alphabet soup of all of the different technologies that are out there. And I think there's such application in revenue cycle for these different groups of technologies. When you look at RPA, or robotic processing automation, that is such a great tool that we use very frequently for all of the data entry tasks or the data gathering task. And man, there's a lot of them in revenue cycle. Payer to payer, you are following different processes around gathering data or entering data. And so it's a great tool for that. You look at different types of OCR and NLP. So many of our organizations are still getting, whether it's utilization review denials or appeals in some cases, they're getting a lot of paper still, which is frustrating in this environment, right? That we're still getting paper back in certain situations. And so I think that there's applications there. And then, there is absolutely applications for more generative AI too. I do think that there is the best situation is human in the loop. Across all of our revenue cycle teams, we practice a human in the loop process technology. So the different AI formats or augmented intelligence formats are engaging with our resources. And so we allow them to be code breakers and puzzle solvers as opposed to data entry or data gathering folks. My advice stems on be open-minded. It can be scary, especially when we talk about that there is all of these technologies that are out there. And, if you look at any of the media coverage, sometimes it's going to replace everybody's job. And that's scary for folks. And so it can, create some pause. There's absolutely data security concerns. And so done right, it can be important. But I'd say be open-minded. it is moving so fast that unless you have very large IT teams, I don't recommend a build yourself approach. There's really good partners out there that will build you purpose built and will support it for you. And then there's full ecosystems of technology that you can look at that will fit specific functions of need. And so I think that that's important is remaining open-minded, look for the positive, consider human in the loop and enabling your people to be the best that they can. And then also seek out some good partners that are already working in healthcare that can help you get through the sticky situations of PHI and HIPAA compliance and high tech that will, make you feel safe about using technologies to get the efficiency.
Yeah, it's definitely important to start with some technology, in the AI world, even if it covers, let's say 10 or 15% of the task, right? Just to get comfortable with it. AI, you're right, it's thrown out there a lot, and you read a lot of stuff of what's coming down the pipe, and I like the human element. That's still going to be there, especially right now. I still think AI is pretty, it's developing, but it's not quite there. It's getting there. It's getting there super fast. But yeah, I do love the human element there. When you talk about,
I just loved your answer. That was such a great answer.
Really good. We're going to steal that, I think.
Yeah.
We're recording this. We're going to steal that answer. I think we can do that, right? Didn't we have them sign something? We can steal your answers. Yeah, something like that.
Yeah. I've given this answer at probably 6 different industry events, so it's out there.
It's out there.
I think the more of our industry that is adopting it and embracing it, it makes us all better. And so it's by no means proprietary. I hope everyone hears it and thinks about how they can use it in their world.
Yeah. So when you think about the potential impact of collaborating with experts who understand the impact of Medicare Advantage on the home health and hospice setting, what's that potential impact of that collaboration with those experts?
So I have a teenage son, and he likes video games, right? And there's cheat codes to get you through things faster. And I am a believer, so I'm going to steal that. I believe that working with experts is your cheat code. So you don't have to learn by experience. Instead, you can learn vicariously through the years of expertise working in these type of environments from experts. So I think, attending industry events, working with organizations that have some expertise and have some experience in helping other providers get there, it really is the cheat code. You can take all the time and learn it yourself and hit the snags that others have already hit, or you can just work with somebody that'll tell you where all of those are at. So that's my thought on it. I even with what we do at Netsmart and the number of years that I've been doing this, I still seek out other industry professionals that I see as experts in these areas to collaborate with them. So, I know he's spoken at lots of events, but Devin Woodley, that's over at BNS, I mean, he is a contracting mastermind. So anytime I run into something with a client that I, am looking at how do we get through a contracting situation, I call him and ask for advice or tell a client to go reach out to him. He's at a lot of industry events. And then Tracy Hall at Emeritus, she's built such an amazing CBO team, and she's just an all-around great person. She speaks at a lot of industry events. And so I always am interested in picking her brain on what she's doing next. So there's a couple of them out there, and you'll see them at a lot of different shows. And gosh, there's 100 more I haven't mentioned. But I do think that the networking is really important as this is changing, because it's going to take that kind of collaboration to get to that top quadrant for performance.
Yeah, I completely agree. And this industry really is full of people who don't just have the expertise, but are willing to share and are willing to think about the good that can come from having the appropriate tech stack, having those appropriate networking and connections of people to help drive that expertise and then ultimately drive efficiency for patient care. I know it always sounds so cliche, but I do feel like that's really where everybody I know and have interacted with is really about.
Yeah, I mean, it is something that we all share in the human experiences that we're going to interact with healthcare, whether it's for ourselves or for our loved ones. And so I know when it comes my turn to do that, I want it to be as efficient as possible. I don't want to be waiting on prior authorizations or inaccurate eligibility and get a surprise. So I couldn't agree with you more, Hannah.
Well, thank you so much for coming on and talking with us, sharing your expertise. If somebody wants to get a hold of you, wants to learn more about Netsmart and what you are doing over there, where can they find that information?
Absolutely. So I would direct them to our Netsmart homepage. We also have a pretty active LinkedIn feed where we're sharing in webinars and different shows that we're going to. And then I'm also available on LinkedIn. And I think that will be linked on here, the podcast, that I would be more than happy to interact. If you've got a question, reach out. Happy to share our experience.
Thank you.
Eric, you've done a great job. Yeah, you've really done a great job. Really appreciate you making time. I know you're very busy, got a lot on your plate. So for you to spend time with us today to first of all, to show that, gosh, man, there's a lot of things that we can do together to continue to grow and scale. That's what I love about the industry is everybody's all about helping people. It doesn't matter what company people are with. At the end of the day, we want to see these agencies succeed. We want them to see them get paid for the services they're providing. And, kudos to what you said. I mean, you get a good team around you, Erica, there might be times we even come to you because, shoot, you never know, right? I mean, that's what I love about collaborating. So thank you very much for taking time to be with us today.
Absolutely. Thank you guys for the invite.